Hi, my name is Emily Salisbury, and my presentation is on mental health, the way it has been treated in the past, treatments now, the stigma around it, and different types of mental illnesses. People everywhere struggle with mental health. And it affects everybody differently. Some people can function normally and not have any issues, and other people, makes it hard for them to want to get along with other people or get things done at work or things done at home. And a lot of people think like, oh, this person has a mental illness, they're unwell, they're unstable, they're dangerous. And then, people that are suffering do get that stigma, like are affected by that stigma. People can hide that part of them with medications or going to therapy, and they can manage it. But some of the stigmas include like public stigma, and that's where like anybody just kind of discriminates against those who have mental illnesses, even if they don't know them, thinking they're dangerous or not right in the head or anything like that. There's self-stigma, and that is where it's kind of like internalized and you're kind of like against yourself, like, oh, why am I not good enough? Why am I like this? What can I do to make myself better? There's also structural stigma, and that is where like the government or businesses kind of limit opportunities for those with mental health issues or mental illnesses. It can be intentional or unintentional. Stigma can be very harmful for anybody, but with mental health, it could cause more mental health issues. It could cause a person to not want to find the help that they need. Could, they may not feel like they have a support system. They'll be like socially isolated. There's different ways that we could end the stigma or lessen the effects of it. Like just talk openly about mental health, normalize mental health treatments, educate yourself, educate others, stuff like that. Some things I've heard regarding mental health, like people are trying to help, trying to make you feel better, like, oh, it could be worse, or he can never give you more than you can handle, or just do this and everything will get better. That doesn't usually make somebody feel better. There's a bunch of different treatments that they have used throughout history for mental health issues. The medieval times, they were thought to have been possessed by the devil if they had a mental illness, and they would perform exorcisms to release the evil spirit. Or they would use what's called trifling, and that's where they put a hole into the affected individual's skull, and it's said to release the evil spirit. Other types of treatments were, they were thought to be witches, so they would burn the witches at the stake, or they were placed in asylums in the 1700s. That's when they became more popular. And it was for these mentally unstable patients and to kind of isolate them from society. They would lock them in windowless rooms, they would keep them chained up, and they were kind of neglected. Eventually there was a physician, Philippe Pinel, who wanted to help these patients, talk to these patients, unchain them, and a more humane way of treating these patients. In the 1930s is when they started lobotomies, and that's where they would sever a part of your brain from another part of your brain to kind of like, it was like a radical therapeutic measure to help those with mental illnesses. There's different ways now that we can treat mental health and mental illnesses. medications, psychotherapy, which is talking with a therapist, self-management. You can do things to make yourself feel good. If you're spending time with the people you care about or doing the things that you enjoy to do. And then there's a bunch of different mental health disorders: depression, post-traumatic stress disorder, OCD, ADHD, and there's different ways to treat all of these.